Welcome to the Amy Plus podcast. Today's guest, Dr. Zenovia Gabriel, is one of the most well-known dermatologists in all of California, the go-to girl for everything skin. And as we all know, sometimes women can go a little too far with the fillers and the fixes. And when they do, Dr. Zena ever so politely brings them back to reality with that perfect mix of honesty, humor, and heart. Her approach to medicine and how she cares for her clients truly puts her in a league of her own. An expert in skin texture, tone, and transformation, and one of the most refreshing, real, and beautiful women you'll ever meet. So welcome, Doctor.
Thank you. I'm blushing. Honestly, thank you, Amy, so much.
I'm so glad you're here.
Thank you. What a surprise.
I know. I was thinking this morning when I was getting prepared, I've always had a list of guests I've wanted to have on, and a very well-known derm is top of the list.
Oh my gosh. Well, thank you.
And you're finally here.
When I hear you introduce me, I'm like, is that me? So, wow. Thank you so much.
It's true.
I'm very honored. Thank you.
You've made a huge difference, like already in my life, and I can't even imagine how many others' lives.
Yeah. Well, thanks so much. It means a lot. I love what I do. So,
I wanted to first say, I don't recognize you without your white coat on.
I know. Well, I didn't know exactly what to wear. I have a jean outfit in this, but I decided to just kind of think as if I was at a conference because I do speak at conferences. And I thought, let me just kind of zhuzh it up, you know?
Yeah, you look so beautiful.
Thank you.
I mean, obviously you always you look beautiful when I see you in the office. One thing, it's funny, when I see you, you do have your coat on, but I always think, I bet that girl's into fashion.
Oh, I am. Definitely love. Since I was a little girl, I took it after my grandmother, who I'm incidentally named after, Zena. And I mean, still I love to dress up. Still, I think about every piece of jewelry I'm wearing, every, connection. Yeah, I do. I love fashion.
And sometimes I'm like, I'd like to see her closet.
It's embarrassing because I don't tend to throw things away. And I always say the joke is I'm more Jackie O than J-Lo. But I love just like fashion from the 50s and 60s. And then even now, like, and then I always say I'm a little bit more Sid Vicious. I like edginess instead of more mainstream. So I love fashion.
Well, you look amazing.
Thank you.
So when you have the white coat on, is it all about the shoes?
It's funny because I walk around all day. I do have to keep a comfortable shoe, but no, I think about what I'm wearing under the white coat. And I only wear scrubs, unlike other doctors who want to be comfortable and wear their scrubs on every day. I only wear my surgical scrubs on days that I do Mohs surgery. So I definitely dress up every day at work.
I could tell.
I like it.
So for all my guests, because I do podcast a lot of fashion, like influencer, everything. I always ask, what are you wearing? We talk about it. So what is your fit?
My fit. So this is Max Mara. It's one of my favorite designers. And I just think it's the perfect mix of, Italian, refined, comfortable, kind of sophisticated dressing. I love their lines. I love their cashmere. I'm not into, I got this because I felt M stood for mom because I'm a mom first. But yeah, I think it's stylish. I think it's casual, but I still think it's sophisticated. It's from head to toe, Max Mara.
And your jewelry.
Thank you. My jewelry is very simple. I do love vintage jewelry. So this is a compass that I bought probably when I bought it in Boston, and it's a compass. So it keeps me on my path. I bought this with one of my first paychecks as a dermatologist. And I really like this delicate jewelry that I buy in Greece from a designer called Aspriati, and they're just absolutely refined. So it's kind of these trendy little yarn bracelets and different things, but then they do this gold with diamond with it, which I just love. So kind of delicate. And and I remember like being 12 and seeing that Oprah Winfrey had like an eternity band on her pinky. So when I got my first job out of high school, I saved money to buy the Oprah Winfrey eternity band because she was so iconic to me as a little girl.
I've never seen that. I've never seen that turning on a pinky.
She has an eternity ring on her pinky, and I remember loving it because, she was never married, so she never bejeweled herself, but she always had that.
Oh my gosh, what a cool idea.
Yeah.
Well, you look amazing.
Thank you.
I do know Max Mara. I do know that brand. I have a lovely coat from them.
Isn't their cashmere amazing?
Yeah,
Their
it's
coats
amazing.
are, I think, where they angle. I love your shoes. I'm like looking at those. I can't get my eyes off
girl.
those.
Yes, I love these so much. So my look today, ragbone jeans.
Okay.
And then Valentino shoes. And so
Gorgeous.
I have shoe issues because my foot's so ginormous. It's hard for me to find really nice designer, cute, comfortable shoes.
Yes.
And so I wear these a lot, and I got them in pink, and they're only 1.5 inches. And they look a little bow. Is
Darling.
Cute?
No, and it makes your foot look short. I love the cross. Darling.
Yes. And then the silver on the shoe is matching my La Pointe cape. So this is a beautiful designer, one of my favorite, Sally La Pointe. What I love about this particular cape is I wore this to a wedding about 3 weeks ago. Formal wedding, black tie.
Yep.
So I had it over a dress.
Yeah.
But then I can now wear it on this podcast with jeans.
Perfect. And it pulls out the blue. And so you have just like a little black t-shirt under there.
Yep, that's it.
There you go.
Yeah.
Dress it up or down.
Yeah.
It matches your eyes too. It has a little bit of those blue tones.
You should check her out.
Love it.
Yeah.
The point. Okay.
Obsessed. Really good for Christmas stuff too.
Awesome. And I love your jewelry. Tell us about that. I don't know. It's so pretty.
Okay, so I got my stack, girl. You know about that stack. I got the Cartier, my diamond bracelet, the Love bracelet, the Van Cleef, and I have a Mickey Moto.
I saw that pearl.
Isn't
Pearls
that
aren't
nice?
that common on rings. I love it.
Yes. And so my husband is kind enough to gift me Mickey Moto. Probably now about every 2 years. I'll get a piece.
Isn't it gorgeous?
Yeah,
You should walk in one of those stores and you're just like,
I'm obsessed.
Me too.
I went in there to the Beverly Hills about 6 months ago, and now they have those big, ginormous pink pearls.
Oh, okay.
Okay, yeah.
I haven't seen those yet.
Oh, they're gorgeous. It's dreamy.
So pretty. But you know, they have this one piece in South Coast that's like a lariat, and it's got like 12 layers, and it goes down to your knees.
Okay.
Absolutely like
Amazing.
a showstopper.
Yeah, I love
Gorgeous.
them. Yes.
Love it.
So yeah, that's the look. And you know, before we like totally dive into your history, because I know from talking to you, you had no plans of being a doctor.
No.
But I wanted to ask you one quick teaser question.
Yeah.
Because when I was talking to some of my friends and I did like a little story poll, like what's the number one thing that you want to know? I really want to know, since almost all of us want to know this.
Let's go.
I really want to know about the Botox situation.
Okay.
Like what's the fine line of stop with it because you have a stone face and girl, you need some Botox.
So first of all, there's 4 Botoxes, if you will, in the US. Everybody thinks Botox makes people look fake. Botox, if used judiciously, makes you look refreshed, takes away that angry resting bitch face look, and a little bit goes a long way. So, you know, when you think about the industry of beauty, a lot of these companies who make drugs or injectables or even laser devices, they're trying to sell as much of their product as possible, guys. And the consumer of those drugs or injectables or devices are really the physicians who are injecting them. And then the consumer is getting it from the physician. So it's a very complicated kind of industry because it's a middleman, and I'm the middleman, and the laser and the injectable companies making money off me buying their product and then me selling it to the consumer. So it tends to be complicated. There's a sweet spot, Amy, and that sweet spot is you want to look like you. You don't want to erase your expression. You should look angry when you're angry. You should have that twinkle in your eye when you smile. Your upper lip shouldn't be so dead that you're talking with your bottom teeth. Okay, so there is a sweet spot. So I tend to be what's considered a master injector. You know, I've been injecting faces for 15 years now. So I know I analyze each individual person and I analyze their muscle movement. And from there, I can see how much they need, where they need it based on their own anatomy. So I love the natural look. That's kind of my claim to fame is we can cheat, but we don't make it look like we're cheating. We make it look like you've had nothing done. So I think Botox is early. You prevent those crow's feet and those wrinkles from forming. The little 11s that we get, you can prevent those lines if you start Botox early in your life, let's say late 20s, early 30s. And then as you get older, if you stay consistent with it, you're actually preventing wrinkles from being permanent. So I do think there's a place for it, even in women in their 70s and 80s. So that whole 40-year history of a woman's life, I think Botox has a place.
Okay, I'm glad you said that because like my daughter, she's 32, she hasn't done it. She's like, do I start it? And I'm like, I don't care if she does or not, but I'm like, I started when I was 32.
Yeah.
And I felt like that was a great age because I've noticed like you don't have to do it as much.
Correct.
If you start early.
You do. And like, think about it. If you're waiting till you're 45 to do Botox and your crow's feet have now been crunch for an additional 10 years, those skin lines start to etch and now they become permanent. And now it's harder to get rid of those. So I do like the early Botox as preventative and then kind of growing with you as you age.
And still, are you in the normal areas? So
yeah. So forehead, glabella is what we call between the eyebrows. The crow's feet, those are the main areas that people do it. And the key thing about the forehead is you don't want to get too little because then you can get Spock eyes. And you don't want to get too much because then you can lose your arch. So there is an art to it. And then for me, I've got these vertical little lip lines that I'm getting, even though I've never smoked a cigarette in my life. Sure enough, they pop out, they're lipstick lines. So I do a couple units there, and that also softens those little vertical lip lines and gives you a lip flip. So those are the main areas I do. But sometimes we get a stronger muscle at the corners of our mouth, and women at rest kind of just look like this. And it's called the resting
that's
bitch
what
face.
I'm doing right now. I can feel myself. My lips are like.
Exactly. So, we don't want to kind of look like this when we're like reading the newspaper or watching TV. So you can release that muscle tension by doing a couple units in this muscle called the depressor angularis oris, or short for DAO. And that releases this and you go like this. Dink.
I've not tried that.
Yes.
I need to do that.
Yes. And then
Because
the
I feel it. I'll see like pictures and I'm like, ew.
And it's funny as as we've studied anatomy, women's faces become more like muscular as we get older. So we get hyperactivity of the muscles, which is very interesting. Our body, you kind of lose muscle, but your face gets what we call hypertonic. And you start to do that because your muscle's stronger. The other area I love, Amy, is that little kind of crinkling in the chin that we get. It's called the peau d'orange chin, where when you talk, it kind of crinkles. You can relax your chin and make it really smooth with a little Botox too. So that's kind of advanced Botox.
So this podcast is totally worth it. I just totally learned something great new. That's amazing.
Try first, little bit.
Yeah, I don't do it that often. Probably twice a year.
Yeah.
Maybe.
Do you feel softer after?
Yeah, I feel great.
Yeah. There's another little thing that people are talking about too. And I mean, these are, again, the companies trying to make more money. But one of the things that we notice is that when people have Botox and they look less angry, people respond to them differently. So some of the companies that create these neuromodulators, that's what they're called, they're neuromodulators, they want to get it FDA approved for depression or anxiety, because if you look softer, you react to me in different way. So people are treating it almost like a psychiatric medication because people are interacting with you different. You have less depression, less anxiety because people are nicer to you. So it's very complicated. How we interact with our fellow humans relate to the expression in our eyes, the lovingness of our facial movements. So if you're kind of like this and then Botox makes you like that, people like you better. It's bizarre.
I can totally see that.
Yeah, very deep stuff.
Well, I want to be liked more, so shoot me up. Give me some more.
Okay, is that possible? Who doesn't love you, Amy?
So you mentioned the lip flip. That's not something I've ever done. I do want to say that I have had a few friends that have done it. I'm going to be honest with you. It looks funny.
Yeah.
So I don't know what the difference is, what you're suggesting and what they're doing.
So the lip flip that we're talking about is done with Botox or the other neuromodulators, Xeomin, Dysport, Daxxify. And it's just it's 4 units, 2 on each side, that just release that tension. So it kind of pulls out your lip just a little bit. It's not lip filler. Lip filler is when you're injecting a jelly-like substance.
We're going to get into lip fillers. We're going to talk about those fillers.
Now, speaking of your little friends who you're like, I don't know if I like it. If you put too much, then they kind of can't move their upper mouth. Like. And it's almost like they have what, like a little, what we call, the psychomotor component of their mouth isn't moving correctly.
Girl, if you're on Spotify and you can't see the doctor right now, she has the exact look as my friend.
It's like you can't do it.
Yeah.
And so, again, it's about amount and delicate placement, and you never overdose. So I always tell people when they're new, I'll say, hey, I think you need this much, but we're going to go light. We're going to do micro tox. And if you need more, I can always add. I can't pull out what I put in, but let's do it slow. So you need to find doctors and providers who are willing to work with you, learn your face, and customize your treatment versus jack of all trades, robot medicine doing the same thing for every patient. And that's the key to aesthetic medicine, I think.
Well, that's an amazing thing. I really want to go into that and talk about that.
Yeah.
Where is medicine going on all those things? But before we do that,
okay,
I definitely want to talk about immigrant parents.
Okay.
And how you had no plans on the whole doctor routine and you end up at Berkeley. What's like the short version of how in the world you got there?
Really interesting. So I come from a Greek American family and I'm first generation. My father was born in Greece on an island called Tinos. And my mother was born in Ohio, but grew up in Long Beach, California. Got married at 18 when she went to Greece for vacation with her Greek mother, my grandmother, who I'm named after. Met my dad, had a summer romance. She was 18, he was 25, and they moved to California and had to live at my grandmother's because they had no money. And they basically had 3 kids by the time my mom was 23 years old. So I come from very humble beginnings, but an extremely loving Greek family. We spoke Greek in our home. And my mother was very young, having 3 kids by the time she was 23. I have 2 brothers, an older and a younger, who I'm very close to. My grandmother was a heavy hand in our home. My father was fresh off the boat, but very devoted, very hardworking, and your classic, nose to the grind, working every day. He was worked as a forklift operator in a grocery store, and he was a union member. So he was one of these men who just worked their tail off. And then my mother was, interestingly, she lost her youth because she had kids so young, and she started working almost like a Mary Kay lady, because she needed an outlet. She had 3 kids so young, and she started working part-time with a jewelry designer out of LA that was making chain by the inch. Do you remember you could determine how long? So the guy who invented that was a gentleman out of Beverly Hills, and he met my mother and said, oh, you'd be a good sales lady. She was 25 years old. She started doing that, and she got involved in the jewelry industry. And my mom's been doing costume jewelry, from 25 till now. She's now 74, and she's been in the industry doing that initially. She owned her own retail stores, and now she works with a manufacturer. So my mom is her own businesswoman, and she's, self-motivated, a created entrepreneurial spirit. And so I got a lot of my chutzpah from her.
Are they still in Orange County?
They are. So my mom, my dad passed away 5 years ago, and my mother lives in Long Beach still. So she's very close to me. She still works, and she helped me raise my kids, as did my grandmother. My grandmother only died 3 years ago. So I was raised basically by 3 people: my immigrant father and immigrant grandmother, and my first generation mother, who had a lot of hustle. And she took care of both of those people, right? Kind of courting them through the American life. And I got my discipline and my ideas of perfectionism from my dad. And you never cut corners, and you do the right thing even when no one's watching. So all that ethics came from my dad and my grandmother, high standards at every level. My grandmother was very religious, and so she made me have respect, poise. We were very our house was immaculate, always have respect for your elderly. So real good, earthy people. And we were raised Greek Orthodox Christian, so very tied to the church. And so there was a lot of values in the home that were unspoken, but also shoved down your throat. And I just had great beginnings. But the problem is no one was really educated. No one had formal education. My mom never had an opportunity to go to college. She just graduated high school, went on a high school trip to Greece, and met my dad and got married. Bada bing, bada boom. My father was an orphan at 2, never got educated. So it wasn't until I was at the junior college, I graduated high school, was kind of like the popular cheerleading type,
I could totally see that.
My older brother was very well liked, but not an academic at all. So he really didn't put the plant the footsteps for me. And I started at the local junior college and was working as a waitress. And I started to love learning. And in junior college, I met a former high school student of mine, a friend of mine, who, had a crush on me in high school, but I was too cool to pay attention to him, kind of thing. And I crossed paths with him, and he said, "You're too smart. You need a transfer." And I was like, "What's transferring?" He's like, "Well, you can go to junior college and transfer to a 4-year institution, either Cal State's or the University of California's." And I said, "What's that?" And so he kind of opened the door to me being like, whoa, there's something more out here. I just thought I'd marry my high school boyfriend and get like a part-time job. I really didn't have a tremendous amount of ambition. But this young man named Adnan Raza basically taught me that there's more out there. So as my natural competitive self, Amy, I asked him, I said, "Well, what's the best university?" He's like, "Well, it's Berkeley or UCLA." And I was like, "That's the one I want to go to." I just had a little cocky edge to me. And I went to my counselor and I said, "I want to transfer." She said, "These are the courses you need to take." Now, it's important to note that what the courses I was taking, I was loving. Like I was taking, US history. And in high school, I was kind of babysat. No one really mentored me. I didn't have those mentors. So here I was in the junior college and I was learning philosophy and I was learning about Nietzsche and, Plato. And all of a sudden my mind just started to open. And so I was definitely a sponge. I loved to learn even at 17, 18 years old. And I applied to college and I wrote my own essays. There was very little computer work. And I got my big, envelope in the mail. No one got emails back then.
Yeah.
I ran into the house. I'm like, "Oh my God, bye-bye. I got Dad, I got into Berkeley." And he's like, "What's Berkeley?" And I was like, "It's a university." And he was like, "Where is it?" I said, "It's by San Francisco." And I'll never forget this. He was sitting in his little chair. I was in the kitchen, like kind of shaking with excitement. He's like, "How can you leave the house? You're not married yet." Okay. That is the kind of home I came from. Okay. So it was kind of like, are we letting her go?
That's like my Big Fat Greek wedding flashbacks.
It was. And so we moved up, and talking about my mom's hustle.
And so you're at Berkeley, and I'm assuming medical anything is not on your brain.
Not at all. Of course, no, because that's for the smart kids, right? So here I am in Berkeley, and I'm like, okay, everyone's smart except me. Like I come from little Huntington Beach cheerleading girl, Greek family who barely speaks English. I don't really deserve to be here. So there was always an element of insecurity in me, and I wasn't smart enough, or my family shouldn't be here, because I just didn't feel that I was equipped like I considered most people. But I was equipped because my parents gave me the foundation, and that hard work ethic is what pulled me through.
Question, what were you going to become?
Okay. So at Berkeley, I remember we sat down with my mom, with a counselor, and they asked, "Okay, what is going to be your major?" And I'm like, "I don't know." And they're like, "Well, what do you like to study?" And it was kind of like a choice. And I said, "Well, I really love, history and law and society." And they're like, "Well, you could be a history major." And I said, "That sounds great. I love history." I was very interested in why people do the things they do, how civilization developed. And they're like, "But that requires an honors thesis, a senior honors thesis." And I'm thinking, what's that? I just didn't have the vernacular. I didn't know what these things meant. They're like, "Oh, that's an original piece of research you read in your senior. It's about a 40 to 60 page manuscript." I'm like, okay, not for me. So we went kind of through the majors, and I found out that political science was one at Berkeley where you didn't have to do a senior thesis. I was like, okay, that's good enough. So I was a poli-sci major. And once again, very engaged learner. Learning, opening my mind about everything from Latin American politics to the origin of law in the United States. Just expanding my universe, my understanding of the world. And I had lived in such a little protected bubble that I kind of just was a natural learner. And I wanted to feed my brain all the things, and I was naturally analytical. And it just kind of opened my mind to the world at large. And I thought I'd go into public policy. Amy, I wanted to make the world a better place.
I can see you as like a Judge Judy.
Something. My
like
heart.
I can see that.
Mm-hmm. And I did have a soft spot for the underdog because I came from that. Mm-hmm. Okay. So I had a definite soft spot for the underdog. So in Berkeley, I thought with political science, I could maybe go to law school, become an educator, go to public policy. I could make an impact on the world at large. And it wasn't until my senior year, I got a job at the vice chancellor for research office. Let me go back a little bit. I had to pay for my own college because my parents really didn't have a lot of money. So I was getting student loans at the time. And in order to get some money from the university, I had to have a student job. So I got a job at the vice chancellor for research office, which is a pretty important office at the University of California, Berkeley. And basically they recruit all of the academic talent. So let's say they need, a head of the law school. They will do a worldwide search, and there's a very intricate, kind of detailed, thorough process. So there's not nepotism. You're not just hiring your uncle's best friend, right? They're doing a worldwide search to fill that extraordinary, important, position. And I got a job with, the reason I chose it is I saw that the woman who was interviewing was Thalia Papadopoulos. And I'm like, okay, she's Greek. Maybe I can get this job. So I interviewed. I was, 18? And she was like this kind of little hefty, like Aunt Jemima Greek lady. And she hired me on the spot. And she's like, you're just going to be making coffees. You're just going to be making copies of the resumes. They're called curriculum vitae, not resumes. And you'll just be my assistant. And when I started the job, I was like, it opened my mind because I would get these resumes, if you will, and they were like 40 pages long. And they were filled with academicians who had done primary research in their field. I'm talking about chemists, physicists all over the world, professors of law. And I was just like, whoa, I might be at Berkeley, but there's another level here. And there's so much that any of us can do to make ourselves amazing and proficient and educated that I can't stop here. And so it kind of opened me up to the world of super academia. Around that time, as that was really a growing kind of thought in my mind, I had to do a volunteership at the free clinic in Berkeley, which is filled with drug addicts and homeless people. And I was there one night. And mind you, I'm a poli-sci major. I'm about ready to graduate. I'm thinking about maybe going to law school. I've got my little job in the vice chancellor's office. So this is kind of the station I'm at. And I'm at the free clinic, and I see this about a 65-year-old Jewish woman who's been running the free clinic for about 30 years. Okay. And she can manage the HIV pregnant woman who's an alcoholic, some kid who just fell off his bike and cracked his head open, some college kid who's drunk. She can manage the homeless guy and the other girl who's, hemorrhaging from a miscarriage. And she's managing everyone with compassion, know-how. And my jaw dropped. And it brings tears to my eyes because I will never forget that moment. I thought, oh my gosh, I would love to be her, to be able to have that ability to manage the chaos of humanity at this very expertise level. I wonder what it would take if I wanted to be a doctor.
That's the moment.
That's the moment.
Wow. That lady.
That lady. And the way that she did it, she wasn't a bitch. She wasn't demanding. She did it with compassion and know-how. And so that level of know-how and compassion was like, wow, this is really interesting. And I did love the human story. I like humans. I like to understand them. So being a physician to me was exciting and also obviously aspiring. But I thought, no way. Like, I am not a science kid. After you had
the first thought, first thought, no way.
No way. First of all, I'm not a science kid. I'm not like some, Asian mastermind playing the violin since 4:00 in the morning, because that's what I assumed were the science kids and the math kids. That takes the real brains. These soft sciences like sociology and poli-sci, you don't have to be that smart. I got away with it Okay, but that's for the smart people. That's kind of what my immature mind was thinking at the time.
And this is your junior year?
This is like the beginning of my senior year.
Okay, so it's time to
like, let's
make a
go.
decision.
And I went to bed and I was humming along my senior year thinking I was going to apply to law school. But that thought kept coming into my mind.
God implanted that in your head.
It did, and gave me that opportunity. He did. And so I went to that clinic several other times. And finally, when I had my exit interview with my counselor, because Berkeley and all the UCs require that you have an exit interview, my counselor's like, so what are you going to do? And I was like, I don't know, but I'm going to take a year off and just think about it. But gosh, I'm volunteering at the free clinic, and I would just love to go to med school, but I know it's, not my path. And she's like, well, ding, ding, ding. There are these programs, Zena, that you can do called post-bac programs. They're post-bachelor's degree programs for people that have, let's say, English degrees or social science degrees, and you decide to go into field of medicine. You go to these schools and do 2 years of just the requirements for med school. There's only 5 courses that it takes to get into med school. You can major in basket weaving. And if you take these 5 courses, you can apply to medical school. And I was like, really? And then she showed me which programs do that. Bryn Mawr, Columbia, those were all super expensive. But there was one close to my parents' house called Cal State Fullerton.
Perfect.
And my parents lived in Huntington Beach. Cal State Fullerton was about 35 minutes away. I researched it. I phone called it. And sure enough, it was a 2-year program where you can go as a poli-sci major, like I was, history major, go there and take your sciences and apply to med school. So I moved home after I accepted my political science degree at Berkeley. And I started this post-bac program at Cal State Fullerton. Took me 2 years. And I worked as a waitress again, actually a grocery store this time. And I borrowed my grandfather's car who had just passed away. And I was living at my parents', saving money, driving to Fullerton, taking my science courses, and setting my dreams big and far to apply to med school.
That's so inspiring.
It was
Quite the story.
It was ballsy.
So when did you finish up in med school?
So it's a good question. I did 2 years at Cal State Fullerton. And because I knew that you really needed some research to get into medical school, they say the hardest part about being a doctor is getting into med school. Tough to get into med school. Very competitive. I did do a year of research at UCLA after I finished my sciences. And that's a really great story, maybe for another time. But I ended up getting a research job at UCLA, and I spent a year working there. And that single-handedly poised me to be a competitive candidate for medical school. And I started medical school in 1999, early 2000s, graduated med school in 2003.
From UCLA?
Actually, I went to med school at UC San Diego.
Oh, okay.
Okay, good question. And went to med school at UC San Diego, lived in Del Mar, California for 4 years.
Beautiful.
It was phenomenal. And again, then that journey was, what kind of doctor do I want to be? So just getting into med school was unfathomable to me. I didn't really felt like I belonged. And I felt like, once again, faced with, oh my gosh, everybody else is smarter than me. I don't deserve to be here. I'm only a poli-sci major, and I just took the requirements. Do I really deserve to be here? Am I smart enough? Can I do this? And so always that self-doubt and that wondering if I had what it took. And so it wasn't until my freshman year, they have a white coat ceremony, which is very darling. Did you go for your daughter?
Oh, yeah. It was beautiful.
Isn't it special?
Very special.
So when you get into med school, they give you a short little white coat because you're not a doctor. You can't wear a long one. And they, when they introduce you, it's a family event. They introduce your name and they tell you what college you came from. And I remember at that time I wasn't married. They were like, Zenovia Hatzaris, UC Berkeley. And I was like, okay, that's kind of a lie because I went to junior college first, but okay, we'll just keep it Berkeley.
We'll keep it.
But everybody else was like, Matthew Lutch, Harvard, Aaron Auberg, Stanford. All the kids that were going to UCSD were at the top of the undergrads. Okay, it was a very competitive med school. And I just thought, oh my God, I am going to die. This is judgment day. I don't belong here. Okay, buck stops here. Zena, you've reached your limit. And so when I started my classes in med school, I was petrified to fail. And that fear of failure is what made me work so hard. And I was just an ardent studier. And I learned that from my dad. You don't cut corners. I was the one staying up till 2, 3 o'clock and then going and taking the exam at 7.
Were you the ones that got the best grade on the exam?
Yeah. So that you've heard that story. Okay.
Those type of people, I wasn't that great of a student. I was like, how are they doing this?
Yeah. Well, it's funny.
Study, but not like them. I love that.
You know what? And I never thought I had it in me, but, yeah,
because you had said something when I talked to you before about how you got the best grade.
So it was the first exam in medical school. And again, a lot of self-doubt at that time. It was biochem, and it was an extremely basic science course. And I had no biochem. I just did the basics, okay? Some of these kids were biochem majors, right, that were coming into medical school. And I was a poli-sci major. Like, what the hell? So it was the first exam, and the teacher came in, and this is before everything was electronic. He's like, the average was a 53. And, so more than half of you failed. And we're just like, okay. And then he's like, and the high was a 92 and the low was a 31. I remember these numbers. And I just thought, which asshole got that 92, And everyone, it was on a board in the last 4 of your soc, and everyone's like, cramming around the glass thing and looking. And I saw that I got the 92.
Wow.
And I went home that night and I sobbed in my pillow thinking like, can I do this? And I just had that Tiger Woods moment, fist in the air, like, let's go, And so it wasn't until then, right, getting into Berkeley, getting the scholarship at Berkeley, getting into med school. It wasn't until then when I'm like, I can play with the big boys.
That's amazing.
So it takes something, we need to prove it to ourselves, I think. No one can tell you you're awesome. You need to feel that.
When you were telling that story, it did remind me of my daughter who finished med school. She's going on to be a NICU doctor, but she told me several times during medical school that she dealt with, what was it?
Imposter
syndrome.
Yes.
And that's what that reminded me of, because I feel it's probably pretty common with most people in medical school.
Yes.
That they just don't feel like they're good enough. They don't feel smart enough. They don't feel like they should be there. And she really struggled with imposter syndrome. Can you touch on that?
It's funny. It's like feeling like when you're in a station of authority, you almost feel like you don't deserve to be there, or your knowledge isn't good enough to be there. So you feel like a fake. And that's where the word imposter comes from. And I think it's a little bit overused right now, because all of us, wherever we come from, you gain an expertise in something. And when you're an expert in something, it requires grit. It requires hours. Okay. You're not an expert unless you've done the time. Okay. So I think when you're in medical school, like Kelly was and like I am, we often feel like there's so much information. And even if you're some, cocky guy or arrogant person, you always feel like you don't know enough. And I think it's very common in medicine, but it's also very refreshing because you need that humility. It's that Greek mythology saying, drink, a little knowledge is a dangerous thing. Drink deep or not from the Pierian spring, meaning if you know a little bit, you don't know enough. So it's in medical school, there's so much information about the human body. Chemistry, physics, biology are such complicated subjects that I think it's a really common thing. Doctors always feel like they don't know enough, but that's refreshing because you want your physicians to stay humble and at the edge of knowledge.
Yeah, I'm going to tell her to listen to this podcast to show she's encouraged.
Yeah.
Because I know she still struggles with it some, which I tell her all the time. I think that's perfectly normal, and that's only going to help you grow.
It is. And what's interesting is even when you get out in practice, let's say she passes her boards. Okay, she's a pediatric ICU physician, which is a neonatologist. I mean, a tremendous amount of responsibility. You don't have just the baby's life in your hands. You have the parents, the grandparents, and everybody. Mm-hmm. And so that amount of pressure and that amount of information that she needs to know to manage the biology of a newborn baby is so immense that the average person, I'm sorry, just doesn't have the demand to take on that pressure. So Kelly's a very special person in a very special field. And she needs to know that it is going to take about 4 to 5 years when you're out on your own, making those important decisions without your superior right behind you saying, yeah, Kelly, do that. And it wasn't until I was a dermatologist about 7 years in, 8 years in, and now I'm 15 years in, where I'm like, I know what this is. I don't even need to biopsy it. So it's like that 10,000 hour mark. Mm-hmm. It's like that knowingness. And I know athletes get there. It's called flow. You're not even thinking anymore. Mm-hmm. It's just in you. Mm-hmm. And so that takes time.
Yeah. And I think like just telling her that's okay. It's okay that it takes 4 years or 5 years. Yes. That's okay.
And you're on that journey and it's okay to be there and you got to be there to get there. Mm-hmm. It's really a beautiful thing.
Okay. So derm.
Yes.
How do you end up in that field?
Okay. So interestingly, so my personality in med school was very competitive and I was considered a gunner, always, trying to be a class act and an A student. And I really like surgery. I loved working with my hands. I was like, let's fix this and get these people out of here. I loved kind of procedural medicine. So there's really kind of 2 groups of medicine, doctors who do procedures and doctors who don't, and then a couple in between. But I also knew, Amy, that I was a family-oriented person. And as a young woman, I wanted to raise a family. So it was kind of like, internally I was torn. I loved transplant medicine. I thought the transplant surgeons were some of the smartest doctors I ever came in contact with in the entire hospital. They knew the entire physiology of the body. They knew how to run livers, kidneys, everything, and do the surgery on top of it. But they had no life. So I knew I couldn't do that because I was really looking for a balanced life and family was so important to me. So I basically had to boil down which surgical specialties gave you a semi-good life. Mm-hmm. And it boiled down to 3 of them. And it wasn't derm. Otolaryngology, which is ENT, ophthalmology, which is the eyeball, and urology, which is the general urinary system. And I did a rotation in each one. And the eyeball grossed me out. I could deal with buttholes and vaginas, but I couldn't deal with
I thought you were going to say the opposite. You're like,
I couldn't deal with eyeballs.
I couldn't deal with the buttholes, but you're like,
no, okay. Like everything
interesting.
Else I could not, okay. And it was just like, I got this nauseous thing operating through a microscope, and just like, oh, the eyeball. Okay. I didn't want to hurt anybody. Otolaryngology is phenomenal. There was a lot of surgery of the hindbrain. So there's a piece of the skull and the cranium. And a lot of the operations are very delicate and a lot of nasal work. And I hated operating through a small hole. That killed me. So I'm like, yeah, no. So again, process of elimination. And urology, I came this close. I loved creating a neobladder. Someone had bladder cancer, you took a piece of their colon, you created a bladder out of their colon and they started, or taking out a kidney for renal cell carcinoma. Those, I was like, yes, but there's a lot of urology that's male genitalia, erectile dysfunction. And it was, I don't know if the guy that I was working under spent a lot of time on male anatomy because I was like, kind of like a dermatologist, I can't do vagina all day long. I can't do male penis all day long. So it kind of eliminated that too, even though I was there. Okay.
I mean, let's keep it real. A male penis is not that attractive.
You got it. Okay. So, but there's so much more to urology. So I don't want to minimize that. But it was like, and then someone said, you know what? You need to take a month off and just go do derm. And I'm like, I'm not going to do derm. Derm's like a cream pusher. They're barely one step above the Clinique counter rep. I was like putting down derm. And I went and did a rotation just to kind of take a break. And I loved it. And I happened to be lucky because I did a rotation with the Mohs surgeon at UCSD. So I was really doing derm surgery for the month, not creams and rashes and acne. And I was like, whoa, this is heavy surgery. You know, a lot of flaps, cancer removals. Every procedure was novel because you had to close it in a unique way with these rhombic and geometric flaps, and it was very visual spatial, and you slept in your own bed every night.
That's the key right there.
So
it's 9 to 5-ish.
You got it. Ding, ding, ding. I still felt like a sellout. I still felt like, okay, I need to be in the OR. I need to be in the ICU like Kelly. So it was hard for me to, like swallow it. But you know what I also did? I started asking my surgical mentors, if you were me, what would you do? Like, oh, look. And I got the surgery award in medical school. And
of course you did.
And they asked me, they're like, what would you do? And I would ask like some 60-year-old, plastic surgeon or some general surgeon. And they're like, don't be stupid, be a dermatologist. All of them told me derm because they're so exhausted. And even though they're happy in their careers and they did what they did, they're exhausted. And so derm is kind of like the, shoot, who doesn't want to be a derm? It's kind of a joke in the hospital. You're kind of a sellout. So I kind of listened to these people. And then I realized, oh my gosh, you got to be top of your class to get into derm. It is a quite competitive residency.
I have heard that from Kelly. She's told me it's very competitive.
So, and it's competitive because it is a good lifestyle. And at this point, doctors are looking for that.
Isn't
especially
plastic
this generation.
surgery same?
Plastics. There's about 6 or 7 that are really high up there, and derm's one of them. But I knew that I had to be at my top of my class to get it, and the rest is history. I was just very driven.
So you mentioned the word Mohs surgery.
Yes.
It made me think of something. You were right.
Tell me.
Okay, I'm going to tell you. So I went into your office and I had some skin cancer on my shin.
Yep.
And you biopsied it.
Yep.
I remember this. It was a few years ago now.
Correct.
But you were like, you didn't think it was going to come out anything. You're like, it's probably going to be fine. And then I remember you come in and you're like, I'm actually surprised it came out positive.
Yep.
And you said to me, I think you should go. No, I remember now. You said to me to get the radiation.
Yep.
That was it. Okay. Backstory to that I never told you.
Yeah, tell me.
I had skin cancer on my nose in Texas.
Okay.
Years before I met you, because I have a dermatologist there.
Got you.
I went through it with the radiation. So that was me. I can't remember exactly, but you would know. I had to go in like 5 days a week.
You got it.
Every day, 5 days a week for 3-4 weeks. I can't remember how long it was. It was a lot of driving. It was just a big commitment. So I got the radiation on my nose, no scar. So I go to see you a few years later. My shin comes out positive, and you were like, I think you should do the radiation because you're so sweet. You go, you have the prettiest legs.
Yes.
You have nice legs, Amy, and you wear dresses and skirts, and you don't want that scar. And I was like, what's my other alternative? And you said, well, you could go get it cut out, which would either be cut or end up being Mohs, but you could end up having a present scar. And I was like, I thought about it on my own. I was like, I don't want to do it because I just didn't want to drive, which I should have done. You were so right, because I ended up getting there and they cut out the first section and ended up getting it all. So I never got the Mohs.
Got you.
So I now if I lifted up my thing, you could see it. It's pretty. I'm just going to show you real quick.
Let's see it, girl. Yeah. Let's see it.
So it's right here.
Oh yeah, it's there.
Yeah.
Not bad though.
Yeah.
Not bad at all.
I mean, he did an amazing job.
He did.
By the way, amazing doctor.
And it's one layer. That could have been 2-3 layers.
It could have
been a different ballpark.
Yeah. So I just want to let you know here on the podcast that you were right.
Okay. Thank you. Well, it's funny because one of the key things to note is that as a Mohs surgeon, I still recommended radiation.
That is interesting.
So it's like I'm giving up the case. Now you could have like 10 surgeons here and they'd be like, oh, radiation has a higher recurrence, blah, blah, blah. But hey, if now we have about 20-year data on superficial radiation therapy for superficial skin cancers. Not all skin cancers can be treated with radiation. So again, it requires judgment. It's not black and white, okay? So you had a superficial basal cell. I didn't want to botch your leg. Mohs is the standard of care, but superficial radiation therapy would have been scarless. Okay?
Yeah. Oh, well.
So, but guess what? That looks good.
Yes,
Your doctor
it's fine.
did a good
It's
job.
fine. And I think, question for you, would it have been different if I was older or didn't wear shorts or, would you have made a different decision?
The answer is this. Okay, it is a little more complicated. Below the knee tumors, below the knee cancers, notoriously don't do well with surgery. Because below the knee, the circulation is poor. People tend to get wound infections. There's not a lot of redundant tissue. So if you have a big hole, how do you close it? It's not like, where the face is mushy or the chest or neck. So the lesions that are below the knee, I kind of always like to do radiation if I can, based on the pathology, how superficial the actual biopsy shows. Because if you've got a deep tumor, sometimes you can't do superficial radiation. But incidentally, the driving thing, just to correct, sounds like what you had, Amy, when you had your nose. You went and got like the full radiation, which is 5 days a week for like 4 weeks.
Yes.
Superficial radiation therapy is a new protocol. You'd have 2 treatments a week, not 5, and it's for 7 weeks. So it's a little bit more spread out. And again, it's a 5-minute appointment. So I now do superficial radiation therapy in my office, and I have a radiation oncologist that doesn't do it. And you want to know why? I want to do what's right for the patient. So even though I'm a surgeon and I want to cut everything out of you, at the same time, I know sometimes it'd be better for you to get a little radiation, because why would like a 35-year-old botch her little nostril when I could just zap it with a little radiation and you're one and done? So I am liking the modality, but again, depends on your pathology.
I bet they didn't have that in Texas. That new
I see.
every 2 weeks.
Yeah, and that's not that it's new, but it's a protocol that I think depends on the device you're using.
Yeah. Well, so my derm in Texas, which I love him, by the way, it was so funny. He always said I was one of his favorite patients because I always had complicated issues, right?
Yeah.
I wasn't your standard, like just come in, check
You
your
challenged
moles,
him.
Yeah.
Uh-huh.
And so, I had obviously some skin cancer issue and like my little keratosis little spots and stuff. But it was funny because I remember he had reached his wits end with me. He was like, there's nothing else I can suggest to you about your spots and stuff. And he was like, why don't you go to one of those fancy Orange County dermatologists, because they probably know way more than I do. I'm a little doctor here in Texas.
How cute.
And he would be like, I bet they know. And
How
I
funny.
remember when I came into, I moved to California as well. I lived both places, but I came to come see you. And I remember him saying that because you did have a lot more.
Yeah.
I don't know.
Like, for example,
up to date stuff.
Let me give you an example. It's not that it's up to date, but like obviously the way medicine has gone for the last, let's say 200 years is we're treating disease. You get a disease, you go to doctor. Get a disease, you're going to doctor. Only in the last 15, 20 years have I think that medicine has kind of focused on preventative care. How do we prevent, cancer or prevent things from forming, and overall general health and wellness? I mean, health and wellness wasn't a concept in the 50s, right? We all ate margarine and shit. So it's just a different world now. So like, for example, for precancers, I see a lot of actinic keratoses. Those are the things that we all get frozen, and golfers and lifeguards, they get those frozen all the time. Well, you can take niacinamide, and that is a little vitamin that you can take that prevents those from forming. You can do these creams that reverse DNA. You can do photodynamic therapy, which is a laser procedure that erases those precancers. And once you're getting rid of the precancers, they're not progressing into cancer. So those are preventative things. And I like to do kind of full throttle for people, because you don't just want to sit there, wait for the cancer to show up. So I kind of like to provide a little something extra like that.
Okay.
Yeah.
Well, it's amazing. So one thing I also wanted to talk about, when a new patient comes in and gets a consult, you have a very special, one-of-a-kind technique. Can you tell us about that?
Yes. Okay. So basically, I call it my signature 4 consult. And the reason why, Amy.
Signature 4 consult.
Signature 4 consult. Okay. It involves analyzing each patient's skin that I see in 4 ways. I look at your color, texture, volume, and elasticity. And the reason why is I think beautiful skin, I don't care who you look at, let's say it's a woman or a man, you're like, damn, their skin looks good. What are the features that make their skin look good? And it's really 4 things. Their color is even. They're not brown, red, blotchy. It's one color, okay? Their texture's smooth. They don't have lumps, valleys, bumps, big pores, wrinkles. That's smoothness or texture. Volume is the fullness of the face, and volume shifts as we age. So it can't be too full and it can't be too hollow, because as we kind of shift volume with aging, we get folds. So volume analysis is important. And lastly is elasticity. How tight are you? And so right now in the age of information and, social media, of course, everybody is being bombarded with the next best procedure, what makes your skin amazing, the best cream, and people don't have guardrails. So you can't imagine, I live in Newport Beach. Every day someone walks in and is like, I want to do microneedling. And I'm like, okay, hold on. Let's think about why. And I'll be like, do you want to improve your color? Is the color bothering you? Are your brown spots bothering you? Because microneedling ain't going to do that. Okay. So I go through this analysis to guide people on the procedures that are going to fix the problems in their particular face. Mm-hmm. And that helps patients know where not to waste money and what procedures will work on them. So like for you example.
Talk to me, girl.
Okay. All right. When you look at
I'm under this podcast light. Talk to me.
Okay. If we had a mirror, you would look at your face, and this is how I start the consult. Mm-hmm. And you would look at your face and I'd be like, okay, Amy, what do you wish you could improve? And you would look in a mirror and you'd be like, I don't like blah, blah, blah. Can you think of it off the top of your head? What do you wish you could improve? Because you have gorgeous skin.
I would definitely say my spots are the number one thing that bother me.
Got it.
My face does not quite have as much like on my arms. I'm glad you asked this. Because I know you asked about my face.
Yeah.
But what are
spots? Those are called solar lentigos, which are like freckles, or keratoses, seborrheic keratoses. That's what I thought they were, keratoses. And you can freeze those or you can laser them.
Because I have them on the sides of my face.
Yep.
And I swear I think it's from like driving in the car.
It
or
is.
I have a ball cap on and like I've got the sun on the sides because I don't have any here on the forehead.
It's true. So it's definitely sun induced. And this is how we start the consult. And you basically divulged the spots bother me. So you're not telling me I don't like my sagging, I don't like my wrinkles. Like we're focusing on spots. So that's color. And then underneath color, there's 3 things to fix color in the face: topical therapy, chemical peels, or lasers. And I have a grid on my wall in every exam room, and I show what is the solution to your color problem. So for keratoses and for that pigmentation here, I would recommend a bleaching cream, which is a prescription bleaching cream, and maybe a light laser that can buff and shine those out. That would be the solution to the color problems. And that's it. The arms, creams don't work on arms. Why? Bleaching creams and retinols don't work on arms because the epidermis is thicker. Can't get inside. So you got to get in to erase those brown spots. And the way you do that is with a deeper laser.
Okay.
So like a Fraxel, for example.
A Fraxel. Oh,
okay.
Okay, so that's the one that you have some downtime.
That's the one that I recommend. There is a little downtime.
Doctor, I'm so scared.
No. Okay,
I'm scared.
I always ask. I love it. You're so darling. What are you afraid of? The pain? Looking crazy? What is the fear coming from?
I would probably say both of what you just said.
Yeah.
I'm a wimp. Like I'll go get Botox and I'm like, put the ice on it before you shoot me up. I'm the wimp. And so the Fraxel, I have had lasers before, and I remember I had one laser in particular, and I think it was a newer laser that they were kind of experimenting on. I got it on my face and my neck, and they had it on the same level or whatever.
Yeah.
And my neck burned for 2 weeks at nighttime. So I was trying to sleep, right?
That's kind of traumatic.
It was traumatic.
Yep.
And my chest was on fire, and I couldn't sleep, and that took 2 weeks of my life, right? So I'm scared. I'm scared of the pain.
You should be scared. That's called post-traumatic stress disorder. Okay. The answer is I'm the biggest wimp in my office. Okay. With hands down, I am a nut about comfort measures. So we numb you completely, so the pain is not an issue. Let's check that box, girl. I've got the Ativan in the office. I've got the laughing gas that I can put you on. I do not let one person feel pain in my office because I am the biggest wimp. I cuss like a sailor when you're plucking my eyebrows. Okay. So I do not like pain. And it's funny because I'm a doctor and I inflict it all the time. So I'm very sensitive about that. Okay. In fact, this morning I had a lecture for my nurses and my doctors who work with me. Our approach to pain in the office, because the other day I saw a laser nurse doing hair removal and the patient was squirming. And I said, I will never walk into an office again and see somebody squirming. Not in my practice. I want everyone to feel comfortable at every minute.
So what would you do for that laser treatment?
So first of all, for that laser treatment, I would stop the procedure. The patient's already feeling pain. I turn off the lights. I sit the patient up. I reset the nervous system. I put on more numbing cream. I get the Pronox and have them have the laughing gas. I ice the area as I'm lasering. So because ice causes a little differential in the pain response in the brain, I do everything. I don't just keep going because I'm like, I just got to get this done because no, the patient's first, comfort first. Okay. If you can't handle it, I'll numb you with lidocaine, girl. Like, let's say I'm doing your lip filler. I'll put a little lidocaine in there and I'll do it underneath the lip like a Dental's because I don't want you to feel anything. So pain. Now, the other fear you had, darling, which is somebody botched me. That's a tough fear to get rid of, you know? So I try to engender confidence. I definitely would do a lighter laser on someone like you who's had a bad, unexpected outcome. And I would walk you through it like a kit and glove. And I would give you the red carpet. And I would do it light, and I'd give you a little result, and then we up the ante on your next one. So it's a relationship business.
I love that.
It is.
It makes me feel a lot more comfortable.
It is, because these things are scary. I'm afraid to do procedures because I'm afraid of getting botched, you know? I'm very afraid.
So what about the downtime of one of the Fraxels?
Really good point. So there's a lot of lasers, and you know, I like to give people ranges. And I say that lasers go from level 1 to level 5. Okay, we have 11 lasers in our practice. Level 1 is like something very light called the Spectra Peel. Brides do it before their wedding day, literally. Okay, and all it does is it takes that dead layer off so your makeup settles nice. No downtime, no pain. Level 5 now is kind of like what Joan Rivers used to do. Okay, you burn your skin off like a CO2. This is for deep wrinkling, and you walk away kind of bloody. So there's a big range.
I wish you could see my face.
Yeah,
right
okay. It's a lot, but there's a range. Fraxel's in the middle. It's not light where you're not getting the results, but it's not deep, and so you have about 4 days of what we call a little bit of bronzing. Okay, and with someone like you and me who has a little bit of apprehension, Amy, I would do a light one on you. So you get the results, you're excited about the next one, and you'll have about 3 days of sandpaper face. You don't look too puffy. You're not, about 48 to 72 hours in, you could wear your Jackie O glasses and go to the grocery store.
48 hours.
Yep. On the light one.
So is this what when my husband does a boys trip every year, I'll wait for him to go.
That's what you need to do. Oh, so many women do things when their husbands are out of town. You have no idea. So we got to make them look good when that man comes home.
Okay. So do you also recommend doing the neck or chest at the same time as the face?
I do. And it's funny. I think a lot of women neglect their neck. You get that golden
That was one
thing.
of my questions. Okay, let me tell you this, doctor.
Tell me.
Another part that I remember about our first consult was you came in, we met, lovely, loved you, but you took a look and you said, your face actually looks really good, but you're neglecting your neck.
Exactly.
That's what you told me.
Okay, you remember that. I don't even remember saying that, Amy. Okay. You remember that. Good.
Could you expand on that?
So yeah, I think that, as you know, we all look in the mirror all the time. We're plucking our eyebrows and brushing our teeth, and the face is something but the neck is one of the early signs of aging, as is the chest. And I think a lot of women neglect their décolleté, and around 45 years old, 50 years old, the neck starts to look older than the face, and the chest too. And so I do recommend daily sunscreen on the neck and chest, starting as early as 25. And I do recommend a reset procedure in your early 40s to kind of get that looking the same. So many women through the 80s and 90s made their face look amazing, and then their chest looked 70, their face looked 40. Okay, you need to balance that out a little bit. People are like, well, I don't want to waste the money on my chest. And I'll be like, but baby, that's what's aging you. Okay, so you do got to pay attention, because the décolleté is a very feminine feature on a woman. And I do think it needs some care. And so getting that to look not exactly the same, but you can't be perfectly, porcelain white here and this be a blotchy mess because it's a disconnect.
So the Fraxels do well on the chest.
I do that. And there's the Fraxel is like saying Kleenex. There's many types of tissue. Okay. I like the Fraxel. There's another one by Lutronic called the Ultra. There's another one by Cynosure. There's many different ways that you can buff and shine at that level to remove pigmentation. The Moxie, the Fraxel, the Ultra, I love. The Mosaic is another fantastic. So there's a lot. But what you want to do is when you go into your derm, you want to say, the brown spots really bother me, or the wrinkles really, you got to define what bothers you so that your doctor can address that issue. Okay. And they'll know the laser that's going to address that issue. I'll give you an example. I see people all the time, I'm like, oh, you need a little Botox. They're like, that doesn't bother me. I'm red all the time. And they don't like their redness. And they feel like they look like they just had a glass of wine all the time. They look flushed. And I said, excuse me, you're right. We can address the redness. If you want to address the redness, that's a different laser called the V-beam. So again, it's listening. It's addressing.
It's funny you say that too, listening and addressing, because Joe and I were talking, because he knew I was podcasting you, my husband, and we were talking about some of the doctors that we've dealt with in the past, let's say 5 years or more. And a lot of times it has been a bit disappointing. For example, I have a pinched nerve in my neck, and it is getting better, but this was, started 3 years ago, 4 years ago, and I got to the point I was in so much pain I was considering surgery.
Shoot.
And I never did it, which I'm glad I didn't. Saying that, I went into one of the doctors a lot of people in Orange County or LA, they're like, go into LA. Like they have some of the best doctors. So I did that. I walk in, I have my questions. Doctor, I'm in pain. Like, this is a serious issue.
Real.
Like, to think that you're maybe get surgery, that's a big deal.
Of course.
So I go in like, oh my gosh, relieved to even have this appointment to get an answer.
Correct.
So I go in, my husband's with me. I have maybe 5 questions. I get to like question 3, 2 minutes in. And what does he do? He looks at his watch.
Shoot.
And he's like, he kind of, gives that. And then I was like, oh no, he didn't. Because I'm like, am I bothering you? Do you have somewhere to go? Like, this is really important to me, right? And a similar story with Joe, basically the same type of story, which I would like for you to talk about that in the field, the medical field, because you are clearly so different with your approach with your patients and how you care about them so much.
Such a good question. I mean, I'm a physician and I go to doctors' offices and they treat me bad. So I mean, it blows my mind. I don't think it's as common. I don't want to believe it's as common as maybe we've experienced. But I do think that there is, first of all, there's different personalities that go into different fields. Okay. To me, the primary thing you want out of your physician is someone who gives a damn. Someone who's willing to go the extra mile, someone who actually cares about you. And I think that comes from an ethos of a person who just cares about people. And I don't think you can really learn that. And I do think that quality is diminishing just in society in general. There's a level of selfishness, I just think, at large. And I do think it even permeates the medical field. So even though medical schools try to filter out kind of the bad seeds, people that are going into it for the money, or people that just don't have that humanistic, compassionate quality, it's hard to pluck good people out that are also have the brains. So it's difficult. I don't know the answer to that, Amy, but I will say that I have experienced that kind of neglect and stuff like that. But at the same time, as a physician, I have such respect for medical expertise that at times, even when my dad had Alzheimer's and I was kind of combing the world to figure out what was happening to him, there was, this physician who was really well-renowned, and they treated our family very poorly. And I remember thinking, it's okay, because he just knows the most. And that's not okay. Okay, that's not okay. So I've struggled with this as a doctor, as a person who provides compassion, and I don't know the answer to it. But I will tell you, we ended up going with a physician for my dad that showed my mother the most compassion.
That's what we do.
You do, because we're all seeking people who care about us. We all are searching for relevance. We want to be relevant to our spouse, to our children, to our relevance is so important in the human condition. So for me, I want to make everyone relevant in my practice. But I take it like too far. I think this comes from my Greek roots. Like, you care about people. You know, you have a warmth. There'll be a little old lady, miss, whoever, itchy on a Thursday. She can't sleep at night. She's itching all over. And, she gets dry skin. So I give her a little shot of cortisone. And I'm thinking on the weekend, I hope Irene is okay.
Aww.
I hope she's not itching. Because, she was going crazy, itching all night, not sleeping. And when you take an 85-year-old not sleeping, it messes them up.
Yeah.
So I do care. And I don't know how you teach that. I teach that to my kids.
Of course. Well, I think what you said is true, because if I experience neglect on my consult, I'm not going back.
Exactly.
So I think it probably does catch up to them a bit.
It does. It does. And so, my in my office, we have a motto. It's called patients first. So I'll hear the girls. I have a lot, 20 employees, and all the girls are like, she did this. I said, what happened to the patient? I don't care about who did this, how she said this. Is the patient okay? So having that patient at the forefront of every decision that you're doing. And I think it's kind of like the Amazon Jeff Bezos, customer first. What is the interface that the patient is experiencing? And I mean, we do everything from write out handwritten notes. So the patient really matters.
Yeah. Well, I'm glad we talked about this, because I think it's important. And
It's
I
a
don't think
big
we
deal.
should, settle. Keep looking for the doctor that's perfect for you.
You do. And that someone that cares. But it is a balance between know-how and someone who's going to, but it's amazing. There's a lot of amazing physicians out there who know a lot, but don't really have the human qualities. And those doctors tend to hide in fields that don't really need a lot of human interaction.
They should go into research.
Yeah, exactly. Yeah. Or just stuck in the OR.
Yeah. So I did want to talk a little bit about men and their skin.
Yes.
My husband, if he can hear me, he's here at the house. I heard him come in from golf.
Joe. Okay.
Dr. Zini drives me crazy.
Okay. Tell me.
Okay. So he won't do skin products. He does one. I've got him to do one, but he goes, takes a shower, use the regular soap, the Irish, what's it called?
Irish Spring girl. Okay. He's old fashioned. I love it. I love that smell. My dad used that. Okay.
I know. And then that's essentially it. But for some reason, I have over the years, he will take these, what's it called? Retexturating activator and from SkinCeuticals.
Okay.
And he'll drop it and he'll put it on his face.
And he loves it.
And that's it. Right? That's it.
What does he love about it?
I think it's like a routine he's gotten in.
Okay.
But
it could be anything and he just would do it.
Yeah. Okay.
He just likes this product.
He likes that routine, and that's it.
I have an idea.
Wear sunscreen.
Yeah. Oh yeah. They don't like it. No one really does.
He won't wear sunscreen. And I've tried to tell him there's better sunscreen. Don't go to Walgreens to get your sunscreen.
Nope.
You got to get this stuff. And he golfs 4 days a week. Right. And the little brown spots.
Yeah.
And anywho, there's my
my
frustration.
So first and foremost, men don't like skincare by and large because they like to feel clean. That's been my experience with men. They don't like that goopy, layered feel. They want to be clean, okay? They also are low maintenance creatures, okay? So, for example, we know through the studies that Allergan has done, the makers of Botox, men complain that Botox only lasts 3 months. They don't want to go in every 3 months and get it done. Just like women, we color our hair every 3 weeks. We get our nails done, whatever. Men don't want that. Low maintenance. So I think, creating a regimen that's low maintenance for men and that doesn't require a lot of layering is the magic and the secret whisper to your husband. I suspect the reason he likes that is clinical, you said?
SkinCeutical.
SkinCeutical little thing is because when he puts it on, Amy, I suspect, darling, that it goes on naked.
It soaks
in.
Mm-hmm.
He doesn't feel thick.
Mm-mm.
He doesn't feel like there's, goop on his face. So I bet you could give him any serum and he would do well with it. So he's a serum guy. If you could nudge the needle, my philosophy as a derm is very simple with skincare, both for men and women. In the morning, you want to protect your skin from damage. That's it. What does that mean? Wearing sunscreen and doing an antioxidant. Those are my two go-tos in the morning. Moisturizer, serums, mist, toners, icing on the cake. The bread and butter of dermatology skincare is an antioxidant and sunscreen. And the sunscreens I like are lotions that go on naked. For example, one of the most desired sunscreen in men is by Isden, which I see you have a little Isden product here.
Mm-hmm. Yeah,
okay,
I was going to show you that, girl. Uh-huh.
Isden makes a sunscreen, and you know what it's like? It's like a liquid.
Mm-hmm.
Men don't mind it. Doesn't smell, goes on naked, and it's fantastic. Okay? So that's not the sunscreen, but I'm just saying Isden is a great
brand.
company. And you're right. You can't just go and buy a Neutrogena 100. That's like toothpaste.
Mm-hmm.
No man's going to put that on. But finding a sunscreen, and so what I would do for you, I would give you like 3 samples of what I consider to be male-liked sunscreens. And the 3 are Eucerin Sunscreen Face Lotion at Target, Elta MD UV Clear, men like it, it goes on naked, and the Isden. Those are 3. And I'd give you little samples and I'd say, have your husband try this, see which one he likes.
Okay.
Okay?
All right.
And you tell him, baby, it goes on naked. You won't even smell it or feel it.
So he's on the understanding, and I think this is a thing these days, and I think you even touched on it. They say sunscreen is bad for you.
Oh, okay. It is a very hot topic in dermatology. Mm-hmm. We speak about this at the scientific meetings called the American Academy of Dermatology, and it is an extremely researched subject. How much vitamin D do you need? Do the nanoparticles go into your bloodstream? I mean, it's like very researched, discussed, and essentially it's called evidence-based medicine. The answer is using sunscreen prevents skin cancer. That is a fact. We know it. We believe it. We also know that sunscreen, the way they're formulated, doesn't go into your bloodstream and cause particles to go into your bone marrow. We've studied it. We do know that sunscreen can destroy the coral in the oceans. That's kind of the nanoparticles. So it's funny, they've researched that. It's environmental impact. So I do believe that somebody like your husband, because it's hard to convince people, even from a doctor. I mean, I like to point to a very well-versed like journal of drugs and dermatology, and they'll do like a review on sunscreen, and I'll give a skeptic. Here's a little article I want you to read. It's kind of bathroom reading, okay? Knock yourself out. Let me know if you got questions. And these are the 2 areas I want you to read. And then I'll like circle the side effects. And it's just opening dialogue. You're not going to convince someone by mansplaining things. You got to show them the road. You got to explain your opinion, but you got to corroborate it with know-how.
So me, like when he's on the way to golf and chasing him out the door going,
I love you.
You forgot your sunscreen.
I love you.
That's not the right.
I love you. You know what's funny? No, well, it's funny. Men just don't like that layer. They don't like that goop. A lot of men will do the spray. And then wives will ask me, is the spray good? I'll be like, baby, take it if he's willing to use it.
Yeah.
I don't think it's the best because it only blocks certain ultraviolet rays. The spray sunscreens are not a physical blocker. So I like the zinc and the titanium dioxide. Those are the physical blockers, Amy, and those do better at blocking both ultraviolet A and B. The physical blockers, which are the chemical sunscreens, are in the sprays, and those don't block those. So it's like, it's kind of half good.
Okay.
But better than nothing.
Okay. You take what you can get with these men.
But I do think if you find a serum, and guess what? That retexturizing serum that he's using by SkinCeuticals, that has a little bit of glycolic and lactic acid, which I believe, I think it's glycolic. It enhances cell turnover. So he's using something
He's
good.
doing something.
Yeah. Be proud of him.
So speaking of serums,
yes,
I have a few little.
Let's take a look.
Get my little
Let's make
box
some space
here. Move the champagne glass.
Mhm.
I wanted to ask your opinion. We
Got
are going to wrap up after this,
Okay.
and we're the audience doesn't know this yet, but we're going to have a part 2
I'm
because
excited.
there's so much more to talk about.
Thank you.
Okay,
Thank you.
so-
I loved it. Thanks.
This is not my skin washing routine.
Okay.
My husband laughs at me. He's like,
Yeah.
"You take 15 minutes to get ready for bed," but I
Yeah.
enjoy it.
Tell
It's
me
the
what
thing.
you do. Like, go through your regimen.
Okay, so I have all the things for
Removing your makeup.
removing the makeup.
Yeah. Good.
Right. So I think you would approve on all those things.
Mm-hmm.
Afterwards,
Mm-hmm.
I use the pads that you
Love it. By Dr.
sell.
Zenovia. Mhm.
Yes, and we're going to talk about that in part 2. I want to
Okay.
talk about your brand.
Okay.
So I want you to tell us after I say all this what the pads do and how
Okay.
important that is.
Love it.
And then after that, and I do a different routine. I don't do the same thing every night, but this is just an example. There's the vitamin C.
Mm-hmm. Do you do that morning or night? The CE
I do the
Fairy Lake.
morning.
Good.
Absolutely.
Fabulous.
This is I do this morning and night. It's the only one I do both.
Good. I love
Vitamin
that product.
C,
Mm-hmm.
and then the phytocorrecting gel. I'm gonna be
Mhm.
honest with you, we're sitting here. I don't remember what it does anymore because
That
I've been
decreases inflation.
okay. Thank you because
Mhm.
I've been using it so long.
Yep.
And then the infamous retexturating
Yep.
activator.
Got you.
That my husband
Yeah.
has agreed to, but it's a replenishing, resurfacing serum.
Got you.
And then after
I need
that,
my readers to look at the ingredient.
I
on
know.
that,
I
but
can't
that's
believe
okay.
I can read
Yeah.
this. You mentioned this brand,
Mhm.
the
Isden.
Melaclaire
Melaclaire.
Advanced.
Mm-hmm.
So I'd love for you to speak
That's a
on that.
lightening agent.
And I have several night creams, but I just brought the Augustine Bader.
The cream, the rich cream.
Yes, I have the
Fabulous.
rich cream and the
That
regular
entire
cream.
line was created from that product.
And then I did buy this from you.
The fresh.
I have.
Oh, this
I
is
do
the
use-
radiant all over. Okay.
Yeah, I have used it before.
Yeah.
I don't use it a lot, so I
Yeah.
wanted you to touch on that. And this is so funny.
How
Dr.
cute is
Zena.
that? I see that.
This is your card that you give to everybody.
I'm so moved that you even still have it.
I
Oh my
have this,
gosh.
and I've had it for so long.
You're
'cause
so cute.
It's a morning and evening routine.
This is like a relic. Look at that.
But do you see what's on there?
Your lipstick.
My lipstick sticks.
is so cute. Look at you. That is so
I've had
girly.
this so long that I'll keep it. I'm like, oh yeah, I'm supposed to
Yeah.
go through this routine morning and evening. Oh, and I'm on the way to dinner, and I
So
bought my
cute.
lipstick with it.
I love it. That
So I
is
would love for you
darling.
to just. How am I doing?
Actually, I'm impressed. I'm really impressed. You've got good stuff. So, kind of bare bones, going to your products and my philosophy. I think the morning should be about protection. The evening should be about repair and renewal. Okay. So, what does that mean? I like retinols and glycolics at night, and I like antioxidants and sunscreen in the morning. So, where do you land with your products? Number one, let's go to your evening regimen. You remove your makeup and then you use the glycolic peel pad. The 10% glycolic peel pads are an alpha hydroxy acid. What does this puppy do? It strips down the dead layer chemically with glycolic acid. So you don't have that dead layer sitting on your skin, blocking light from radiating out of your tissue. So when you get a flash of light on your cheek and it's all dry and old lady, that light doesn't reflect back to the observer. That's what radiance is. So when you take off that dead layer, you look radiant. So that's what that guy does.
Okay.
Takes off the dead layer, enhances cell turnover, must. At night, I like a retinol. You've got one of them.
I do have another serum that you gave me.
Okay.
Not serum, but I have been using it.
The
but
retinol,
twice
twice a day.
Twice a day?
Twice a week, I mean.
Okay,
Twice a
so
week,
twice
sorry.
a week.
Mhm.
I think I just forgot to bring that down here.
Okay. I like a retinol on everybody's skin who can tolerate it.
And I would do that after the pads?
After the pad. Okay. Retinols do many things to the tissue, but they're a tremendous collagen preserver. So if you talk to any dermatologist, they'll believe in two things automatically: sunscreen, retinol. Every dermatologist believes in those two things. Everything else is a little bit all over. But retinol and sunscreen, no derm would deny those. Now, what kind of retinol? There's a lot. There's prescription strength. There's bougie soft ones that don't do much. There's ones you buy at CVS. So they're all over the map. A prescription retinol is stronger and better. Okay? But they're very drying. They can be irritating to people that have rosacea. So the right retinol for you depends on what your provider does when you read your face. The strongest retinol is true tretinoin, 0.1%. That is the strongest. And then, of course, there's Tazarac, which is a different drug. But you probably have the one that I told you to do twice a week, which is retinol 0.1. You can up it, Amy, to 3 days a week if you want, if you're not too dry. Your skin, it grows on your skin. It gets used to it. So I love retinol at night. And then you chase it with a moisturizer, like the Rich Cream from Augustine Bader, or even this guy, which is another little lightening agent, which has the melatonin. Isden creates melatonin, which lightens brown spots. So I like to do retinol at night with a lightening agent, because almost all of us make brown spots unless you're like Norwegian. And who's Norwegian, okay? So you got to use a lightening agent. So this plus your retinol and this is your night. Glycolic, retinol, a lightening agent, and a moisturizer.
Okay.
And which lightening agent you use, it could be hydroquinone, it could be a bleaching cream that you get from your dermatologist, it could be kojic acid. There's a lot of lightening agents that lighten brown spots. And retinol lightens brown spots on its own, but it can get a little help. In the morning, I like antioxidants and sunscreen. I love this guy, CE ferulic acid. It's a powerful vitamin C. Vitamin C is very active and it absorbs the free radicals that we get from ultraviolet light. So this is a powerhouse morning product. And your little Fido guy absorbs the other element of inflammation that we get from ultraviolet rays. So bottom line is, you put these two serums on, plus your sunscreen, you got it covered in the morning. Okay. You've got King Kong regimen.
So there was one thing you said I probably should add. What was it? The bright bleaching.
The
agent.
Bleaching, but you've got it right
That
here.
is what this is.
That is what this is.
Okay.
So you got it.
Okay. Perfect.
Okay.
Okay. I feel a little better.
I'm impressed.
Because when you gave me the card, I started doing better with my regimen.
So I do this because people hear about 15% of what doctors say. So I send home a lot of collateral. And one of them is a skincare card that tells you what to do in the morning. And it's broken down into 4 steps: cleanse, treat, hydrate, protect. Boom, 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 boom. And it teaches you. And of course, I have my favorite products listed. And depending on your skin type, I'll mark which product I use for you.
I love that.
The fact that you have this, I love it. So
I was
cute.
debating whether to bring it down.
I love that
I was
you
like,
have it.
do I show this? I'm like, it's real life, you know.
It is, and it warmed my heart that you actually felt it was important.
So this is so amazing. So if you guys are out there and you do live in Orange County, I guess you know which term to go to.
Thank you, Amy.
All the things we could tell that you go above and beyond. It's very much appreciated.
Thank you, Amy. I'm so happy. Thank you for this invitation. This is so easy and so easy to talk to you. You're beautiful.
Well, we're going to get back together and we're going to do a part 2, because I do want to dive a little bit deeper into more things. I wanted to ask about acne, fillers.
Oh yeah.
Laser treatments, hair loss.
Oh yes.
So I want to dive deeper into
some
it.
specific subjects.
This was important for me to ask your story, because I feel like, yes, this is all wonderful, but this was very inspiring to others to seek their journey, that they might think they're going to be one thing and they end up being something else. And so I felt like that was the most important part of the podcast. Saying that, I can't wait to dive in and go even deeper on the whole skin regimen.
Appreciate you. Thank you for taking the time to listen to my story. You made me feel relevant. So that means a lot. Thank you.
And so, Doctor, where can everybody find you on all the things?
So I have 2 Instagrams, Zena Medical. Zena is my first name, Medical, and I'm in Newport Beach, California. And then my skincare line is Dr. Zenovia, Zenovia, and that's my skincare line. And those are my 2 platforms. And I'm on the internet and both Instagram and TikTok. And yeah.
Okay.
That's where I am.
So we're going to do a part 2, and I hope you enjoyed it. If you did love this podcast, please subscribe, comment, review, all the things, the Amy Plus podcast, and stay tuned for part 2.
Thank you. Bye. Love you, girl.
Love you.